Lithium is a drug of choice in a lot of individuals. Now, lithium is given for the mood disorders, also known as the bipolar affective disorders and also the schizoaffective disorders. It's the drug of choice, and there's a narrow borderline between its toxicity and between its preventive measures for the mood disorders. So one should be very vigilant when one is given lithium as a drug of choice in a patient. The complete monitoring of such patients is very essential. Obviously, it is clinically monitored, as well as a lot of investigations has to be carried out in these individuals. Along with that, acute dystonias are also seen with a lot of drugs, and as well as with a lot of psychiatric ailments. So these are the psychiatric emergencies that we'll be discussing over here in this section of the lithium toxicity and acute dystonias. The lithium toxicity will be discussed, the definition of this syndrome, which is basically caused due to lithium, and again the multiple levels of action of lithium will be discussed, and that will basically give you an idea how this lithium toxicity is created in a particular individual. With that, we'll be discussing the acute dystonias in the individuals. How do we define dystonias, and how do we differentiate this acute dystonia kind of a syndrome with the acute behavioral disorders? So this is basically, again, one of the symptomatology of the behavioral disorders, in which the person basically behaves in quite a strange manner, and that can be regarded as pathological, and one should know how to treat these patients. Again, the treatment modalities are of the same origin, comprising of the pharmacotherapies, the vigilant monitoring of the individual, and along with that, giving him or her the insight by the cognitive behavioral therapies, and sometimes all of these therapies are coupled with the pharmacotherapies to get the patient out of that particular kind of a psychiatric ailment that he's suffering from. Talking about the lithium toxicity, it is basically, there is a narrow therapeutic range that is 1.5 to 2 milliequivalents per liter. The therapeutic dose is very close to the toxic dose. Mild to moderate toxic reactions are seen in these individuals, even who are on the therapeutic dose. So if the patient has taken a bit of an extra drug, he may basically present with this lithium toxicity, or even if he is suffering from some sort of a renal failure. Even in those cases, the patient can represent in the basically this syndrome of lithium toxicity. There are a lot of reasons which basically make the patient more prone to developing this lithium toxicity. So again, I've already emphasized on this fact that if you are giving lithium as a drug of choice, you should know how to monitor this drug as well. Diarrhea and vomiting is one of the symptomatology that is seen, and then drowsiness and muscular weakness is also seen in such individuals who are suffering from lithium toxicity. They can also present as the lack of coordination, the lack of balance, as well as the dry mouth. So all of these symptoms are seen in individuals who are suffering from lithium toxicity. There are multiple levels of action on which the lithium basically acts, ranging from the brain structure and as well as the neurotransmitter modulation. It can also be the basically the intracellular changes. So these are the levels on which lithium is acting. So that is basically the manifestations even that we see in the lithium toxicity. It is basically acting on the brain structure. So it will have all those frontal lobe or all those behavioral disorders seen in such individuals, as well as on the neurotransmitter modulation that will basically manifest as the coordination effects. The balance is going to be affected in such individuals, and as well as the intracellular changes are observed in a lot of individuals. So this is basically the pyramid of actions that is seen in individuals who are suffering from the lithium toxicity or who are on the prescriptive drug, which is the lithium. Lithium side effects can be regarded, or they can be classified into the acute effects as well as the chronic effects. The acute effects that the patient will have will start on right away from almost 12 hours, within 12 hours to 24 hours of its basically oral administration. Nausea is seen in a lot of individuals, diarrhea, lethargy, impaired cognitive functioning, and then hand tremors. So basically the functions would be of the brain type, that is when the brain structures are affected, and after that the impaired cognitive, that is the thinking process, is even affected in such individuals. And after that we'll see the fine hand tremors that are observed in such individuals within 24 hours of time period. Then we'll have the chronic effects that will basically vary from hypothyroidism. People can have cardiac effects. Cardiac effects will basically manifest as tachycardia, arrhythmias, and then the weight gain and leukocytosis is seen in a lot of individuals as well. We'll have the dermatological manifestations as well with lithium that can range from acne manifestations, as well as the raindrop pigmentation is sometimes seen with this lithium toxicity. Acne and psoriasis is seen in these individuals because of the dehydration phenomena. Psoriasis is basically a condition which is characterized by the dry, scaly formation on the skin. So these are the manifestations that we'll see after a chronic use of lithium in people who are suffering from the mood affective disorders and they are put on lithium as a drug of choice. The examination would include the pulse is going to be 108, the blood pressure would be 100/70, temperature would be almost 36.6, and respiratory rate would be 17 per minute. So these are basically the vitals that are going to be observed in such individuals. Then when we have the systemic examination in these individuals, the central nervous system examination would reveal an irritable, a confused individual. Mild tremors and ataxias are going to be observed in such individuals. When we examine the vascular system, the cardiovascular system would reveal the tachycardia, normal heart sounds, and along with that, when we observe the respiratory system is going to be normal in these individuals. The gastrointestinal system would reveal the soft, non-tender bowel sounds, and along with that, they'll present with no visceromegaly. So this is basically the systemic examination of individuals suffering from lithium toxicity. The treatment would consist of sufficient IV fluid replacement to ensure diuresis, hemodialysis to increase the lithium clearance, and they're indicated if the GFR, that is the glomerular filtration rate, if it is less than 60 ml per minute, or the lithium is more than 2.5, delirium, seizures, and coma has to be managed individually. Persistent clinical effects in spite of the fluids are seen in such individuals. Another psychiatric emergency which we have to deal with, it's the acute dystonias that is observed in a lot of individuals. Muscle spasm is observed in these individuals ranging from the face, neck, trunk, eyes, and even the larynx is sometimes involved. Early in treating the young males, and dose-related and tolerance is observed in these individuals. The incidence is almost 50%. The treatment would lie upon the bipyridine administration, IV or IM, 2.5 milligram, very slowly. Then we can also administer Benadryl, 50 milligrams IM, IV, that is 25 to 50 for laryngospasm. Then prevention basically reduces the incidence to 5%, and benztropine is sometimes administered. The dose is 1 milligram in these individuals suffering from acute dystonias. So in this section, basically, we summarize these two psychiatric emergencies known as lithium toxicity and acute dystonias, and how do we go about treating these emergencies is again very important and significant. So that is the end of this section. Thank you for watching sqadia.com.